Swadikap, good afternoon once again. Today, Thailand stands at number 92 ranked around the world. Hoping that we won't climb up higher than this with all our efforts, all our sustained efforts, all parts of our society. So first, thank you to Dr. Tuwisin just now, who gave us the daily briefing. After my session, actually, we'll be having some speakers from the corrections department, as well as from other agencies to talk in detail, such as about the field hospitals and all the other current situations. And then perhaps we will have that summary for you in English in the coming days, just to update you on the various important issues. So firstly, for today, Tuesday, the 18th of May, 2021, we have recorded new confirmed case at 2,473 cases. And out of this number, the majority are from local transmission, which is 2,450 are from local transmission. And out of these local transmissions, 680 were detected from within prisons. And the remainder, which is the smaller number, 23 are from those traveling back from abroad. Today we have 2,718 new recoveries, which is actually higher than the number of cases confirmed for today. We have, as you see on screen, 42,988 active cases still being treated in hospitals. The cumulative since the very beginning, as mentioned, we surpassed 100,000 a few days ago. So it's 113,555. We have recorded 35 new fatalities, making the cumulative fatalities now standing at 643. And out of these 35 fatalities, the majority of it, which is more than half, 16 cases, is from Bangkok, Chiang Rai, Songkhla, Samut Prakan. And I'm sorry, half of this number, the majority is from Bangkok, while the provinces mentioned just now have 2 fatalities each, which is Chiang Rai, Songkhla, and Samut Prakan. Now, 13 provinces reported 1 fatality each, which is Ubon Ratchathani, Sa Kaeo,ศรีสะเกษ Rayong, Chonburi, Pathum Thani, Chayaphum, Lopburi, Nakhon Pathom, Samut Sakhon, Chumpon, Saratburi, and Surat Thani. This shows that the fatalities from COVID are occurring nationwide, and our deepest condolences, of course, goes out to the families of the fatalities. Just to mention first that we are taking very seriously the breaches in terms of our borders, both land and sea borders, because there have been illegal entry from neighboring countries into Thailand, and the enforcement agencies and the security agencies have been trying their best to maintain the security and maintain the surveillance, as there had been up to 100 plus persons illegally entering the country through natural borders recently. Just some observations. We'll have a map of Thailand coming up for you. The overall situation, if you count nationwide, you see a lot of white spaces there on the map. So if you consider the provinces, the situation is actually improving, except for Bangkok and the vicinity, where it remains in red, as you see on the map on screen. 23 provinces have reported 0 cases of COVID today, and 35 reported 1 to 10 cases. We hope that this the number of provinces with 0 cases will continue to increase in the days to come. Now, for the top 10 infected cities in Thailand, it continues to be Bangkok first, Bangkok and its periphery. You can see that 6 out of 10 with new cases in green, I think we have that in green font for you, have reported lower numbers of cases compared to yesterday. So we hope that this will continue in every province. In terms of the clusters in the capital, in Bangkok, we have an infographic for you on the epidemiological situation in Bangkok and credited to the Bangkok Post. And as mentioned yesterday, there are currently 29 clusters in 19 districts across the capital that are of concern. So these 29 clusters in 19 districts, namely Dindang, Wattana, Klong Tei, Laksi, Lat Prao, ราชเทวีพระนครป้อมปราบศัตรูพ่ายสวนหลวงปทุมวันสาทรสัมพันธวงศ์จตุจักรบางรักประเวศวังทองหลางรามคำแหงบางกอกน้อยห้วยขวาง And as Dr. Thuisin highlighted to you just now, as of today, 21 of these districts are still active with reported cases. Now, the construction campsite in Laksi district is a recent cluster that we talked about. It has a high number of cases since yesterday and had reported now more than 1,000 cases from that particular district. And in addition, other clusters were found in Dindang district, Klong Thom Center, the 22nd July roundabout in Pom Prap Satru Pai district, and the construction site in Wattana district. So we continue to monitor the situation closely, and relevant authorities have initiated measures to contain the spread of the virus in these areas to prevent further outbreak in the wider community. And we'll have perhaps some visuals for you coming up also from the Public Health Ministry on recommendations for factories. This is in English, in Burmese, in Khmer, and in Lao. And the Health Ministry and other agencies continue to reach out to all groups at risk. So this is for the migrant worker community as well in their languages. We're together in this fight. No one is safe until everyone is safe. In addition, the Director General of the Department of Disease Control mentioned that the DDC would allocate vaccines to the Bangkok Metropolitan Administration in the effort to have 70% of Bangkokians inoculated within 2 months. Now, for active case finding centers, the Bangkok Metropolitan Administration has set up 7 active case finding centers for COVID-19 in Bangkok from the 17th to the 21st of May as follows. The government complex, the Laksi district, in Laksi district, the 72nd anniversary Minburi Park in Minburi district, Wat Don in Yanawa district, also the park under Rama 8 Bridge, Bang Plat district, Wat Chalerm Prakiat Forest Park, Klong San district, Bang Khae Pirom Market, Bang Khae district, and sports ground in Ratchathewi district. So these are the active case finding centers which will be operational in Bangkok this week until the 21st of May, hoping that we'll find cases and have those particular cases, if any, be placed into the medical treatment system as soon as possible. Now, the situation in prisons, the Corrections Department plans to have prisoners nationwide vaccinated after more than 10,000 inmates nationwide were diagnosed with COVID in the past few days. And the Director General of the Corrections Department had revealed that inmates at high risk of severe symptoms, such as those age over 60 or those suffering from underlying illnesses, would be separated from the main prison population. And in addition, all the inmates and officers, corrections officers nationwide, would be tested every 7 days under this blanket testing scheme. Now, in terms of vaccination, just an update. Continue to see an upward trend in the vaccination. As of the 17th of May, we had administered more than 2.3 million doses already. And of this number, more than 1.5 million are first doses, and more than 800,000 are second doses. Just in closing, still very imperative, very important for everyone to maintain vigilance and continue to observe the measures, the MHTT. During this lifetime, of course, it's on us to take care of those who care for us. And the infographic from the World Health Organization you see on screen provides recommendations on how we can take care of healthcare workers and others who are fighting to contain the virus. So we ask for your continued support for those who have been working tirelessly for more than a year and putting their lives online for us. So basically, this is a summary I have for you for today. Thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
ครับขอบคุณนะครับท่านนร